We have a question here in El Paso from Donna Rice. In cancer patients that are actively undergoing chemo and or radiation therapy, number one, is use of probiotics safe? I think you addressed that briefly, but if it's safe, how much should be given? And this is probiotic.
I do not have, again, I don't have an exact number as far as how much should be given. You know, it's unfortunate that there are studies looking at certain levels, again, ranging from 10 million to a billion, and again, it's going to be very individualized. And the only way to know for sure, because this is not, unfortunately, this isn't something that you can draw a lab to see whether or not, you know, the medication or the nutrition that you provided is going to show you that significant of an increase. The only way you can do it is by doing, you know, examining the fecal, the stool culture to find out what the overall blend of their intestinal microflora is. And from there, then, typically, like I mentioned, an average amount might be anywhere from 1 to 10 million up to 1 billion. So there is quite a wide range. But as far as cancer patients that are receiving chemo and radiation, I've not seen any published data that would suggest an exact amount. But you could certainly start at, you know, the 10 million and then, you know, depending on what's realistic for them, because again, when you start giving the probiotics, the more of the actual microorganisms you give, the more bacteria you have to feed off the prebiotics. So you want to make sure that the patient is comfortable as well and not having a lot of intolerance issues. So you may want to start off perhaps somewhere between the 1 and 10 million range and then reassess.
All right. Thank you, Yvette.
Sure, you're welcome.
Could you address beneficial yeast?
Beneficial yeast?
Yes.
Well, I mean, the yeast that's probably the one that's most studied would be your Saccharomyces boulardii, and again, it does also behave similar to probiotics, even though it's not classified as a actual microorganism, but is considered a yeast. I know that there are many clinicians that have used Saccharomyces boulardii to help increase the amount of these more beneficial bacteria. Again, it's not going to serve necessarily. I was just talking about Saccharomyces boulardii, and again, being that it is a yeast, it does behave like a probiotic, but it again is not going to have necessarily the same exact advantages of a probiotic.
I work in a major cancer center, and they don't use probiotics for the immunocompromised, like the bone marrow transplant patients.
Mm-hmm.
Is there any documented evidence that it's not beneficial or that it would be harmful to them?
You know what? At this point, we just don't have published data in that patient category. I can tell you there's Dr. Martindale, who's now out in Portland, who's looking at basically a couple of sites where they're going to be addressing the use of probiotics in that severely immunocompromised, critically ill patient. But at this point, the study is just underway. But we do not have any published studies to suggest whether it's harmful or not harmful, unfortunately. So a lot of it is just clinical expertise. I can tell you that there are many clinicians that still use probiotics in those very immunocompromised individuals and have good success with controlling. A lot of times the issues would be diarrhea, and have very good success with it. But I don't have anything published, or I'm aware of anything published yet at this time with that patient population.
Negative published?
No, the only thing that's out there would be case reports, which are, again, don't provide very much information, and it's one individual and certainly not anything as far as like a good quality study.
Thanks.
You're welcome.
You had used the term leaky gut, and actually just last week somebody had asked me about that, and I hadn't heard that terminology before. Can you expound on that a little or explain
Well,
it?
I guess a leaky gut is going to identify someone's GI tract where they're going to have, obviously the mucosal lining, the mucosa itself. You're not going to have a nice thick barrier. There's going to be villi atrophy. So in other words, instead of having those nice long villi lining the GI tract, they're going to be very short, shrunken. There could be gaps or spaces between the epithelial cells. So you have a great opportunity for those potentially pathogenic bacteria to actually translocate and eventually end up in systemic circulation. So kind of the leaky gut is that gut that's very much has increased permeability or risk for permeability.
Okay, kind of pre-Crohn's almost, or?
It could be.
And you mentioned the naturally occurring fructans, as in like wheat, garlic, tomato, bananas, and so forth. Relatively speaking, how much of these food items would need to be consumed? I mean, you're talking about grams of FOS and so forth.
Right. I mean, as I mentioned, as little as 4 grams a day, so it's not much. In fact, the article by Moshva looking even at average intake, with an average diet, so that you're getting, you know, your grains and your fruits and your vegetables, basically you're going to find more of your prebiotics in those, for example, like the fruits, the bananas, and because you're going to find more of the soluble fibers or mixed fibers in the fruits. We find on average, if you have a healthy diet, you're getting 2.5 grams already. As far as how much exactly you would need, because they differ significantly between one food to the next. For example, you may only get 15% of that banana provides a prebiotic or those special unique types of inulin or FOS prebiotics, whereas if you were to have even the offering with coffee, like the chicory coffee, if you are eating the chicory, the flavoring or that option, or even the like artichokes and things like that, then it could be a much higher. So it's really hard to put an answer as far as how much you would have to eat. I think the best thing you could do is to eat a well-balanced meal. And if, again, this is for individuals where you question that they are having symptoms that would suggest that there is a potential imbalance. So if there is an inflammatory issue or there is diarrhea where they may need more of the good bacteria, then what might be easiest even is to recommend a chewable tablet or the powder where you know exactly what you're getting. And then obviously if they're eating somewhat of a balanced diet, maybe it's another 2 grams based on the fact that about an average diet provides about 2.5 grams, so that you could at least meet that 4-gram minimum.
Nestle would just like to thank everyone for their participation. Thank you very much.
Thank you.